The impact on the world of music that Wolfgang Mozart had in the late 18th century is likely to be unmatched by any other figure in music in the past or future. His timeless compositions are still frequently used in opera and often in movies and theatre. His prowess is not just one, but all genres of music was unrivaled. His impact on the musical world was limitless, and a look at his achievements would have you guessing he lived a long and prosperous life, but he didn't. He passed away 226 years ago, at the age of 35. We can only guess at what his future achievements may have been if his life wasn't cut short. But why was it cut short? This question may have been answered by a team of researchers late last year. The answer? Kidney failure due to nephrotic syndrome. A normal human body has two functioning kidneys, which have many roles, including the filtering of the blood of toxins and waste, aiding in both hormone and red blood cell production, blood pH regulation, and nutrient conservation. The nephron tubule is the functional unit of the kidney. It is the site where the filtration and regulation of substances needed to maintain a healthy balance occurs. There are roughly 1 million nephrons in each kidney. Blood enters the kidney by the renal artery, which then flows into a complex web of blood vessels, leading to each individual nephron via the afferent arterioles. The blood is then filtered in the glomerulus. Molecules that have a molecular weight of less than 40,000 daltons, such as water, vitamins, and urea, are filtered through the basement membrane and podocytes of the glomerulus into the proximal tubule of the nephron, where the reabsorption and secretion of molecules and ions occurs. The solute in the nephron continues to the loop of Henle, where further reabsorption into the blood stream occurs. The distal tubule and collecting duct follow, where again more secretion and reabsorption of molecules and ions into and out of the nephron occurs. The remaining solute is excreted via the collecting duct and ultimately the ureter. The solute is then stored in the bladder as urine. In a normal functioning kidney, large and medium-sized proteins are kept in the bloodstream and are not filtered out of the blood once they reach the glomerulus, due to their size. However, in a person with nephrotic syndrome, the glomeruli become inflamed, causing scar tissue formations, allowing macromolecules such as albumin, the protein in the blood needed to maintain oncotic pressure, to enter the proximal tubule. There are many causes of this disease. However, the most common cause in adult sufferers is focal segmental glomerulosclerosis. This condition occurs when the podocytes, which are the outer cells of the glomerulus, are damaged. It is a condition that only affects a small number of nephrons in the kidney and only affects small regions of the affected glomerulus. Podocytes, responsible for allowing molecules no larger than 40,000 daltons into the nephron, do not function properly, allowing proteins and lipids to enter the nephron and ultimately be lost from the body in urine, which results in edema, which is the accumulation of water in the body, and hyperlipidemia, excess lipids in the bloodstream, due to the response of the liver in synthesizing the formation of lipoproteins to compensate for the protein loss, a symptom which Mozart displayed severely in his final 2 weeks alive. The condition today is treated with corticosteroids in order to reduce inflammation in the affected glomeruli. However, the results of this treatment are inconsistent, and patients often need kidney transplants in order to avoid kidney failure and chronic kidney failure. In Mozart's time, however, the condition was a death sentence due to the limited knowledge and way of thinking of the doctors in the time. An epidemiological study of premature male deaths throughout the 1780s and 90s shone light on the cause of his death. A spike in deaths occurred in the weeks leading up to his death throughout Vienna. Furthermore, in the the same periods of time in the November and December months of the years prior and post 1791. There are a lot less deaths than in 1791. Coupled with the reports of an epidemic throughout Vienna at the time of Mozart's death, involving the same symptoms that Mozart was showing, researchers retrospectively diagnosed the cause of death as organ failure due to glomerulonephritis, caused by a virulent strain of Streptococcus. Regardless of his death, however, his legacy and music will outlive us all.